Let's talk about periods. What are some reasons for a late period? Great question. It's definitely normal to worry about your period being late or finding it difficult to track. You are not alone. In fact, it's common that the length in between your periods vary a little bit. A healthy cycle can be anywhere from 21 to 35 days long. That means you get your period about once a month, every 21 to 35 days. The average is 28 days. For me, for example, I get my period every 36 to 46 days, which is considered irregular, I think. But I've never had a consistent cycle. Anyway, according to Flo, there are many reasons why someone might have a delayed period. Miss it completely. 1, you're still young or going through puberty. In your teens, it's very normal to have an irregular period. This is because the ovaries may not be releasing an egg every month yet because the hormone levels are still changing. But if you're past that stage, another reason for late periods is stress, including emotional and physical stress. Too much stress can disrupt the body's hormonal balance, which could result in a late or missed period. Another reason, fluctuations in weight. Weight changes are a common reason for a late or missed period. For example, rapid weight loss due to dieting or excessive exercise can affect the body's hormones. And then lots of weight gain can affect ovulation by altering the body's levels of estrogen and progesterone. This can cause irregular periods. And of course, birth control affects periods. The hormones in birth control stop ovulation, but they also reduce the frequency of periods. For people who stop taking hormonal birth control, it can take up to 3 months for their body to go back to its normal cycle. Another reason, polycystic ovary syndrome, PCOS, which is a fairly common condition that causes irregular periods. It also causes small cysts to form on the ovaries when follicles don't rupture to release eggs. Then there's pregnancy, which is another common reason for late or missed periods. If you've had unprotected vaginal sex and then your period's more than a week late, there's a chance you might be pregnant, maybe. You can always take a pregnancy test. Other things that affect periods are thyroid disease, menopause, and other health conditions like diabetes. As you can see, there are many reasons for a delayed or missed period, but if you're having any complications or questions and concerns, see a doctor. And just remember, everyone's cycle is unique, and the younger you are, the less likely it'll be a regular cycle.